Hi, it's Dr. Nasir here at Lotus Cosmetic Surgery in Westport, Connecticut. I'm going to be doing a series of videos about the implant recall, and I wanted to start out by talking about the difference between types of implants. So I have two implants here. They're both silicone implants, meaning there's silicone inside both of these implants. You can see the shells, or the outside, is a bit different. The shells are both made out of silicone. This one is smooth. You can see it's a nice smooth shell. And this one is textured. So if you run your fingers over it, it's rough. So the recall relates to these textured implants. And we're going to talk more about why there's a recall and what you need to do if you do have textured implants. There is an association between ALCL and a type of lymphoma, which is a type of cancer, of certain types of implants that have been recalled, and they tend to be these textured implants. Now, if you have one of these implants, the risk of lymphoma is very low, and there's lots of websites, especially the American Society of Plastic Surgeons, where you can go for more information. But if you do have a textured implant and you're concerned about it, you should talk to your plastic surgeon. Certainly come in to see us for a consultation and get some more information. We're going to continue a series of videos talking more about risk as well. Now, there are hundreds of thousands of breast implant surgeries done every year. According to the ASPS website, less than 12% of those implants are textured like this, and the lifetime risk of developing ALCL with a textured implant ranges between 1 in 1,000 to 1 in 30,000. Now, these data are always changing, and you can always find updates on the ASPS website. We're talking about BIA ALCL, which is breast implant associated ALCL, which is a type of lymphoma that is associated with textured implants. Some people ask us what causes it. Well, nobody knows for sure, but they are associated with textured implants, chronic inflammation, genetics, and time. So the average time when people start noticing symptoms from ALCL is 8 years after having textured implants put in place, but it can vary from 2 years to 30 years and beyond. An ongoing study is going to give us more information about that. If you have any questions, you can certainly call us, or you can look at the ASPS website. The question we've been getting a lot is, what should you do if you have textured implants from many years ago? Should you have them taken out? Should you leave them in place? Typically, the best thing to do is, if you have any concerns or changes to your breasts, you should see your plastic surgeon. He or she can then help you determine the best course of action. But generally, if you're asymptomatic, the FDA recommends just going on with routine care, mammograms if you need them. But typically, if there's any change, such as developing a capsule, asymmetry in your breasts, pain, anything like that, you should probably see your plastic surgeon to have them examined and make sure there's nothing wrong.